Hello, friends. As a pediatric rheumatologist, I often see children with juvenile dermatomyositis, and in this brief video, I shall touch upon this very important disease. Now, juvenile means onset in childhood, dermatomyositis means inflammation of the muscle and the skin. Now, we recently had a girl child who presented with such rashes over the eyelids. As you can see, these purplish rashes over the eyelids, what we call the heliotrope rash, and then there was a flat top papules over the knuckles and over the PIP joints. We call them the Gottron papules. This girl also had significant proximal muscle weakness. The GABA sign was positive, and the muscle enzymes were remarkably elevated. This is myositis with skin rash. That's what we call dermatomyositis. It is an idiopathic inflammatory myopathy. In fact, it's a vasculopathy that affects the vessels of the muscles and the skin, and children present with proximal muscle weakness and the rash. But one of the very important clinical signs is to look for neck flexor weakness. As you can see, when children or adults are made to lie down and ask them to lift their head, if there is weakness here, this is what we call neck flexor weakness, which can be an early sign to diagnose this condition. If not diagnosed in time, these patients can develop horrible calcinosis, as you can see in these radiographs. MRI thigh is a very useful investigation. As you can see, inflammation in the muscles, and that confirms the diagnosis. Now, muscle biopsy is often not required if you have the characteristic rash. Myositis antibody panel can help you classify this disease further. Therapy, yes, we can treat these children with steroids, methotrexate, and a host of medications. The message here: whenever you see a proximal muscle weakness with rash, think of JDM. Neck flexor weakness is characteristic. Timely diagnosis can be life-saving. If not diagnosed in time, these patients can develop severe respiratory failure and die. That's why when you see rash and myositis, think JDM. Thank you.